Today our topic is high blood pressure, the silent killer. Imagine having a life-threatening disease that could take your life suddenly without any warning, but the problem is you're one of the millions who don't know they have it. High blood pressure, or hypertension, is one of the most widespread health problems of the 21st century. Around the world, 600 million people are suffering from high blood pressure, and 3 million of these die every year as a direct result. In North America alone, it's estimated that every third adult has hypertension. High blood pressure can attack people of any age, creed, or color. In the United States, 50% of those over the age of 40 and 70% of those over 65 have it. Because high blood pressure often has no symptoms, half of those who have it don't even know, and those who do know often neglect treatment because they feel fine. Only 1 out of 8 with the condition has their blood pressure under control. Is having just a little high blood pressure really much of a significance? Hypertensives are 8 times more likely to suffer a stroke, and 3 times more likely to have a heart attack, and 5 times more likely to develop heart failure than people with normal blood pressure. Persistent high blood pressure can also lead to irreversible damage of the kidneys, pancreas, and retina of the eye. Hypertension is known as the silent killer. Slowly and silently, it can destroy vital organs of the body without a person knowing it. Unfortunately, for many, the first sign is often a stroke or sudden heart attack. For some, the first sign may also be their last. The nursing homes and cemeteries are filled with many people who had just a little high blood pressure. Do you have high blood pressure? To answer this question, you must first know what blood pressure is. Blood pressure is the pressure of the blood inside the heart and the blood vessels. The higher number is the pressure while the heart is pumping. The lower number is the pressure while the heart is resting between beats. Hypertension is defined as having a consistent blood pressure of 140/90 or above. The ideal level is when the blood pressure is kept below 120/80. Anything above this is associated with increased risk of disease. The higher numbers, the greater the risk. Some people wonder if low blood pressure is a problem around 90/50. The answer is no, just as long as the individual is feeling well. What causes the blood pressure to go up? Approximately 90% of hypertension cases may be related to personal lifestyle habits. The following lifestyle factors have been repeatedly shown to increase a person's risk of getting high blood pressure. Obesity. Every pound of fat requires an extra mile of tiny blood vessels. It takes extra pressure to pump the blood through them. For this reason, people 20% or more overweight are 5 times more likely to have hypertension than are people of normal weight. High salt intake. Around the world, high blood pressure is common in populations where the salt intake is very low. But in places where salt intake is high, such as Japan, the disease is an epidemic affecting approximately 1/2 of the adult population. But the Japanese are not alone. In many cultures, salt intake is on the increase. Americans, for example, consume an average of 2 teaspoons of salt a day. That's about 16 times more than the body actually needs. How about smoking? Just 1 cigarette can elevate the blood pressure for as long as 30 minutes. At this rate, a typical pack per day smoker is elevating his blood pressure for most of the day. Alcohol and caffeine. Scientific studies have demonstrated that even moderate use of alcohol may be the cause of 5 to 15% of all cases of hypertension. Just an ounce or 2 per day is all that is necessary to cause significant hypertension. Studies also show that 1 cup of coffee per day may raise the blood pressure considerably 5 to 6 points. How about plugged arteries? Just as mineral deposits building up in an old rusty water pipe and cause increased water pressure, so narrowed plugged arteries force the body to increase the blood pressure in order to carry the blood supply through the body. Physical inactivity is also associated with elevated blood pressure levels. Stress. Along with these other lifestyle factors, Life stresses can raise an individual's blood pressure. So what can we do to treat high blood pressure? The past few years have produced an avalanche of new drugs for lowering blood pressure. They may produce prompt results and quick fix that people love, but a closer look at the hypertension medications reveals some disturbing facts. The drugs do not cure high blood pressure, they only manage it. In some cases, the medications need to be taken for life, and they may have many unpleasant side effects. Both patients and physicians are increasingly dissatisfied with the drug approach to treatment of high blood pressure. However, it is important to note that people currently taking blood pressure medications should be careful not to change doses or stop medications on their own. Are there alternatives to better drug medications? A number of major scientific studies have shown that a comprehensive lifestyle approach to hypertension can give superior results without the potential of distressing side effects. Most cases can be reversed in a matter of weeks without drugs by making simple diet and lifestyle changes. Here are some of the things proven to be successful in lowering high blood pressure. Reduce weight. When the weight goes down, the blood pressure levels usually follow. Reduce salt intake. A large percentage of people can find relief with just this one simple measure. But getting salt intake down to safer levels requires an understanding of where salt is found. Banning the salt shaker is a step in the right direction, but by itself, it's not enough. This accounts for only 25% of our sodium intake. The real culprits are the processed and fast foods we eat. These account for 75% of our salt intake. Be sure to read the labels when purchasing processed foods. It has been estimated that literally millions of people with mild hypertension could normalize their blood pressure simply by cutting out their total salt intake, about 2 grams a day, 1 level teaspoon. Stop smoking. Healthier blood pressure levels are just one of the many benefits associated with not smoking. Avoid caffeine and alcohol. Eliminating alcohol, caffeine, and cola drinks from the diet will tend to lower blood pressure and do the body a favor in several other areas as well. Reduce intake of high-fat foods. A diet very low in fat, yet high in fiber, lowers the blood pressure about 10% even without weight loss or salt restriction. Eat an abundance of natural foods like whole grain products, salads, beans, fresh fruit. These foods are all naturally low in salt, low in fat, and high in fiber. Increase your physical exercise. Physical exercise is known to lower blood pressure and is indispensable in weight control. 30 to 60 minutes of exercise daily, such as brisk walking or cycling in the open air, is ideal. Reducing stress is also essential. Simply following all the elements of a healthy lifestyle enhances one's ability to deal with life stressors. A healthy body and mind will give you the upper hand in coping with the stresses you face. For example, research shows that regular physical exercise is one of the simplest and most effective means of stress relief. Exercise helps to dissipate the tension, the stress, and depression, which are often associated with elevated blood pressure. While tranquilizers are the best solutions some may have to offer for stress, personal trust in God is the only real effective solution to bring peace to an individual's living in a world filled with anxiety, stress, and fear. God's Word offers wonderful help to those who come to Him with the cares and stresses of life. God says, "Peace I leave with you, my peace I give to you, not as the world gives do I give to you. Do not let your heart be troubled, nor let it be fearful." With these few simple changes in lifestyle, you have an excellent chance of reducing your blood pressure to a healthy level and keeping it there. Remember, health is a matter of lifestyle. Lifestyle is a matter of choice, and the choice is yours. Please share what you're learning on social media. Visit and like us on Facebook. Visit and subscribe to our YouTube channel. And visit and subscribe to the website at brandonseniorseminars.com. Please send us your feedback. Leave us a comment, send us an email. We'd love to hear from you. This information does not replace doctors' expertise, and you should not make any changes in your health without first consulting your physician. Thank you, and God bless.